Today's episode features Ruddy Hernandez and James Puszert from the U.S. Health Advisors Group. I took some of the questions about freelance health writing insurance and asked our experts, so I hope you guys enjoy this episode. Links are in the show notes for more information about U.S. Health Advisors. You can connect with them at www.ushagent.com/Ruddy Hernandez or James Puszert. Enjoy the show. Welcome to the Savvy Scribe Podcast, a podcast for healthcare professionals who want to build a profitable writing business. I'm Janine Kalbach, your host, and I am a mom to 2 boys. I'm a wife, a Great Dane lover, a registered nurse, and a content writing business owner. I am committed to help you moving your business forward because I've been there. I get it. I understand that life is busy and distracting, but many of us are burnt out at the bedside, working too many hours, and are ready for a change. Every week, I will deliver actionable advice and thought leaders in the industry to help you move along in your business. Welcome to the show. Right now, you can save $20 on our mini courses, Plan, Create, Launch, Land, and Grow for $139, down from $159 until August 31st, 2020. Go to www.thesavvyscribepodcast.com and click on courses.
Going back again to just like those basic questions about deductibles. What is just a basic definition of a deductible and what that means in a healthcare plan?
Gotcha. Great question. So a deductible is an established amount selected that you must have an out-of-pocket expense meet that deductible before you're eligible for benefits from the health coverage to kick in. So for an example, if you take a $5,000 deductible, you may be going in 2-3 times a year, health and wellness, maybe a couple of doctor's office sickness visits, stuff like that. Obviously, that is not going to reach a $5,000 deductible. So we do have a no copay plan for your state as well. So no set copay. So if you go into a primary physician's office, urgent care, or the emergency room, the nice thing, you're never subject to a copay as well. So that's a nice plus because copays are one of them things that no one likes paying every time they go in as well. $50 here, $100 here, $250 here, that all adds up. So, so that's exactly what the definition of a deductible is. So
which is why, as nurses, we see the big influx of patients for elective surgery towards, the end of the year or beginning of the year, so they can use up the deductible in the beginning of the year, and then the rest of the year they're covered.
Exactly. So once you meet your deductible, there are co-insurance options on most of them. Even on like a marketplace ACA, Obamacare style traditional plan. Once you reach your deductible, there's co-insurance attached to that. So your general co-insurance options are, the most common is an 80-20 split. So basically, to break that down in layman's terms, they're going to cover 80% of the bill. You're going to cover 20% of the bill. And then there's 70-30 split, same thing. They're going to cover 70% of the bill. You're going to cover 30%. And then there's 60-40s, there's 50-50 splits as well. So once you reach your deductible, there is a max amount that comes after that. So for an example, if you had, we'll take that $5,000 deductible that we were just talking about previously. If you have an 80-20 split up to $20,000, so now you have a $5,000 deductible that you are responsible for. The remaining balance of $15,000 is subject to 20% coinsurance. So you'd be looking at $3,000 exactly on top of your $5,000 deductible. So that's exactly how that works.
Okay, that makes sense. Just a lot of math.
Yep.
A lot of math.
Yeah, exactly. So I just tried to break it down.
Yeah, no, that was perfect.
It's easy to understand.
Example.
Okay, good.
What about, and I know this is like the giant question you probably get all the time from people, is what rates should I expect as a self-employed person? And I'm going to just assume that everyone's in great health, which I guess is the wrong assumption because most of America is not. But say we're in general health, good health, maybe a family, you're covering your couple kids and a spouse.
Right.
What would you say?
So basically how our quote how we establish quotes is generally first-handedly by the age of the individual. So obviously, the older you are, once you reach your 60s, it's obviously going to be a lot higher than, a 25-year-old individual. So that is exactly how we establish quotes. So, for a 25-year-old individual, looking at around $250, just roughly. I'm just giving you a rough
Yeah,
ballpark
that's
here.
all.
And then once you get over your 60s, roughly around $500 a person.
Sure. Well, that makes
And then,
sense.
yeah, and then in the 40 range, just a rough estimate, you're looking at around 350.
A person, like the whole, or is that family?
350 a person. So if you had let's just say a 40-year-old family with a spouse at the same age, and let's just say 2 children, probably looking at around $600 range.
Okay. Well,
Yep.
see that, and that would be a month?
A month, correct.
Okay.
Yep.
Well, yeah. So, see, guys, that's not as bad as probably many of you were thinking. And many of the, people I've heard from saying, they're scared to get health insurance because of how high it could be. And it's very hard to just even get an estimate without going down the whole cycle of ready to buy
Right.
now. And you just want to
Right.
kind of know. So I think,
Yeah.
I appreciate you guys being honest with us and giving us just some little bit of insight on, what to expect a little bit if they are to go out there. And, I
Yeah,
think the
that's
number
why I
one
gave you
thing
the
is
broad
trust.
range,
Yeah,
25,
absolutely.
40, and over
Absolutely.
60s. It's basically, the 3 thresholds of the rough
Absolutely.
estimate there.
So where can my listeners find out more about your company, where you guys serve and such?
Yeah, so you can go right to my personal agent website.
What
And
is that?
anybody can you can get a hold of me at any time. That's at any time, I'm available. My personal cell is on there as well. I will provide that for you.
Okay.
So you would want to reach me via email at www.ushagent.com / my first and last name, which is James, James, last name Puszert, Puszert.
Good. Perfect.
And basically, to run quotes for any individual, all I need is age, height and weight, if they smoke, stuff like that. And we can establish a call to go over that with each individual. That's not a problem.
Perfect.
So
Well,
pretty
thank
simple
you.
with that. And then another website that I can recommend for you with a little about our company as well is you go to james.puszert@ushadvisors.com.
Very good. Awesome. Well, thank you guys so much coming on today.
Yeah, no
And
problem.
do you have anything else you want to tell my listeners while we're at it?
Sure.
Yeah, I mean,
mhm.
one last email that I can include for
Yeah,
you guys
absolutely. Go ahead.
is ushagent.com / my first and last name. I don't know if I gave you that one. So I do have 2 or 3. So
Okay.
that'll give you a little briefing of what we can offer: disability insurance, dental, vision, life insurance protection as well. So we
Perfect.
customize our health plans to each individual needs. So I didn't mean to cut you off there, Ruddy. So you go ahead, buddy.
Okay. My information is identical except for it's Ruddy from the first name, Rudy, and then Hernandez spelled the usual way, Hernandez.
Perfect. Well, I thank you guys again for coming on today, and I will list all this in the show notes so everybody has the contact information. And thank you guys again for giving my listeners just a little bit of general information on what to expect about healthcare plans.
Yes, not a problem, Janine. It was a great pleasure speaking with you again. And, anything that we could do for you down the road, please feel free to reach out.
Absolutely. I know
Not a
my
problem.
guys. Thank you so much. I appreciate it.
Absolutely.
All
All right. Have
right.
a great day.
All right. You too. You take care.
Just an update for you guys. August 1st, 2020, we have onboarded a total of 25 RN writers. I've added 10 clients to my list that keep giving me work to assign to writers. And I am waiting on a huge pharmaceutical company to sign on the dotted line. Nurses right now are making about an average of $100 an article, average payout. And then since March, I paid out $15,000 to RNs. If you want to be part of this, come join us in the Savvy Scribe Growth Lab courses, and you can get this return on investment. Come be one of my writers. Of course, there is some sort of onboarding process. I don't take everybody, but if you take the course, you are in my top pickings. So head on over to thesavvyscribepodcast.com and click on courses.
Welcome, Savvy Scribes, to another episode. Today I'm here with James and Ruddy. They are agents here in Ohio, and we have had some questions from other freelancers and myself about health insurance for freelance writers, and they are here to answer all the things, right, guys?
Yes, ma'am, of course.
Ma'am.
Of course, Janine.
So first, just tell us a little bit about you guys, what you do, where you're from, and then we'll keep going on with some questions.
Okay, well, my name is James Puszert. I reside in Buffalo, New York here. So not too far from you guys, right along the Lake Erie Basin line here in Lakeview. And I'm a licensed agent in your state. I actually serve Ohio a lot with a lot of clients, so I'm pretty familiar with the options in your state. So we do have some great plans that we can definitely help you out with. Nice thing is our plans have no annual deductible, PPO nationwide coverage as well. So that's another nice plus as well. A lot of the plans in Ohio are HMOs, which are very restrictive where you can go, with primary physicians, specialists, stuff like that, and hospitals. So with our plans, you can utilize any doctor, any hospital nationwide. So that's another nice plus. And we generally come in around 30 to 40% less on our monthly premiums as well. So that's another great plus to our policy.
Very cool. How long have you been in this industry?
3 years. 3 years.
You like it?
Oh yeah, I love what I do. Take pride in what I do. Customer service is everything to me. I keep a very tight-knit relationship with all my clients and so forth. And I actually serve the whole country. So with nationwide coverage, we serve a lot of states.
Very good.
Yes. So.
How about you, Ruddy? Where are you from? Where are you in all this?
So I'm originally from New Jersey, but then I moved to Buffalo, and I was over there with Jim. He's actually my trainer when I was in training. I'm also getting up there with all my licenses and everything, but I am licensed in Ohio as well. My background is I'm a veteran. I served in the Marine Corps for 6 years, deployed 3 times. Then I attended the New York Film Academy. From there, I had formal training, and I'm a published writer. I also write for We Are the Mighty. I have over 3.4 million lifetime views over a variety of topics, including health coverage. And like I said, Jim here, he was my trainer. He is the best agent that we had and have currently, and probably will have. And so I'm being taught by the best, so I will also be able to help anybody out.
Very good. Very good. Well, welcome. Thank you guys for taking time out of your day to talk to us and listen to the concerns and questions that we kind of have. And I think just in general, I feel like healthcare coverage, insurance in general, is so confusing to so many Americans. And it should not be that hard, right?
Yes, it's definitely a struggle, Janine. There's no doubt about it. I mean, a lot of people, it's hard to understand and so forth. Our plans are broken down very easily, simplified to understand and so forth.
So basically, with the healthcare provider that being a nurse, I'm able to get healthcare coverage through my company, and even
Right.
that is always hard to understand when benefit time comes around and whatnot. But I think the biggest struggle is when people like me, nurses or anybody self-employed, goes out into the self-employed world without coverage, and then all you hear is how hard it is and how bad it is to try to get coverage for yourself. So
Right.
what are our options? Where can we find the lowest cost yet highest quality type of healthcare coverage plans?
Yes. So for your state of Ohio, we have a a couple different options for our plans. We have a traditional style plan that you select a deductible amount and then, a max out of pocket and so forth. We do have a preferred plan. Both of our plans are underwritten. So if you can, medically qualify for it, you need to be in generally, good health, shall we say. You don't have to be a clean bill of health, but we do have an underwritten plan that generally, in your state of Ohio, like Kaiser and so forth, I'm very familiar with, the plans and so forth there. We generally come in around 30 to 40% less. Even with work plans, our plans come in, a lot lower. So the biggest thing is what you're getting for your monthly premium is what it comes down to. So we have no annual deductible options in your state there that really, are remarkable with the benefits as well.
So it's not as it's a rumor basically that it is hard to get and you're going to be paying way more than you ever expect to.
Well, no, the options in your state are pretty limited and they are very expensive, and high deductible plans as well. So, the one thing when you're selecting a deductible with the plan, unfortunately, you have to self-insure that deductible annually every year. And that does just keep resetting each year as you start the new year upcoming for January 1st. So it is hard to get, coverage from health insurance these days. So with our options in Florida, and all around the nation, doesn't matter, Florida, Montana, we serve every state in the country with our nationwide PPO coverage. We generally come in 30 to 40%, and you get the first dollar coverage without having to satisfy a high deductible every year before you're eligible for benefits. So that's huge as well.
Do you guys have any sources of information that we can stay up to date on what is changing year to year?
Oh yeah, I obviously with what I do, I keep up on new fluctuations of guidelines, stuff like that. Obviously with the government, with Trump, with eliminating having mandated ACA coverage, stuff like that. So it does change year to year, and we definitely keep up on that. That's for sure.
Because it's confusing.
Oh, absolutely. Yes,
it's hard enough to keep together all the changes when you're just self-employed with taxes in general, and then you add in healthcare coverage on it.
Yep, and the nice thing is, I'm sorry, I didn't mean to cut
go ahead. What's the nice thing?
Another nice thing is, being a 1099 that you guys file with self-employed individuals, you can write off all 12 months with your tax advisor with the option that we have for Ohio as well.
Yeah, so I just read that. I actually didn't even know that. I probably would know that if I took healthcare through self-employed option, but I didn't realize that you could write it off. That is a benefit, I suppose.
Yes, that absolutely is. Some plans allow you to do it and some do not, but with the options,
make sure when you're looking, make sure it's one that you can, right?
Absolutely.
So how can just explain to people just that basic thing, that HMO, PPO, what does all that mean?
So an HMO is a health maintenance organization. So basically what that means is you are restricted where you can go within that specific network. So a PPO is a preferred provider organization. That's what that stands for. So you're welcome to go to any doctor, any hospital, and we do cover you even outside of your home state of residency, which is Ohio. It is nationwide coverage as well, which is really nice because most plans only insure you to your state of residency. So that can be, if you do any traveling, if something happens, by law, they will have to stabilize you, but they will, mercy flight you back into your home state because that's where your residential coverage resides. So being able to go to any doctor, any hospital during your travels as well is nice. So HMOs, basically, once you go outside of their network, if they're not established within that particular HMO organization, unfortunately you have no coverage. So
well, and I think that's very nice, with the plans you guys offer with the PPO, because if you're a freelance writer and your goal is to not only have time as you're on your side and flexible, but where you want to work wherever you can. And why not go travel and then know you're covered and know if something did happen, you'd be covered in that state.
Right. So, and even if you move, the insurance simply follows with you wherever you may reside as your
That's nice too. Yeah, for sure.
So that's nice as well.
So somebody did ask us a question. At age 65, if they have to sign up for Medicare, do they have to have another source of insurance on top of Medicare?
So there are different parts of Medicare, supplements Part A and B. So yes, I mean, you can purchase extra supplements to keep out-of-pocket expenses down for medications, stuff like that. So yeah, there are a couple supplements for Part A and B of Medicare plans that will really enhance your.
That's a
health
wrap
coverage.
for today's episode of The Savvy Scribe. Thank you so much for listening. If you enjoyed today's show, we'd love for you to subscribe and leave a review on iTunes or your favorite podcast app. Until next time.